Imagine this for a moment: a doctor walks into an intensive care unit, but before touching a single chart or speaking to a nurse, a quiet system has already scanned thousands of data points, vital signs, lab results, imaging scans, and medical history, and flagged one patient as being at high risk of sudden deterioration in the next few hours. That alert doesn't come from a human expert who stayed up all night reviewing records. It comes from artificial intelligence. And in that moment, time is saved, decisions are sharpened, and a life may be spared. This isn't a vision of the future. This is happening right now. Welcome to one of the most important stories of our time: how AI and health technology are already saving lives, not someday, not in theory, but today in hospitals, clinics, ambulances, and even people's homes around the world. In this video, we're going to explore how these innovations work, why they matter, and what they mean for the future of healthcare. Because behind every algorithm is a human life, and behind every data point is a story that could have ended very differently without technology stepping in at exactly the right moment. For most of modern history, medicine has relied on human judgment, experience, and pattern recognition. Doctors trained for years to recognize symptoms, interpret test results, and make decisions under pressure. But the human brain has limits. It can't instantly compare a patient's condition with millions of similar cases. It can't continuously monitor subtle changes in real time across dozens of variables without rest. AI can. And when used responsibly, it doesn't replace clinicians, it extends them. One of the clearest examples of AI saving lives today is in medical imaging. Radiology has always been a field where accuracy and speed are critical. A missed tumor, a delayed stroke diagnosis, or a subtle fracture overlooked in an emergency room can change the course of a patient's life. AI systems trained on vast datasets of X-rays, CT scans, and MRIs are now able to detect patterns that even experienced specialists may miss, especially under time pressure. In stroke care, for instance, every minute matters. Brain cells begin to die within minutes of oxygen deprivation. AI-powered imaging tools can analyze brain scans in seconds, identifying blocked blood vessels or hemorrhages and immediately alerting stroke teams. Hospitals using these tools have reported faster treatment times and better outcomes, particularly in regions where specialized neurologists are not always on site. That speed can mean the difference between full recovery and permanent disability. Cancer detection is another area where AI is already making a measurable impact. In breast cancer screening, AI systems trained on millions of mammograms can identify early signs of cancer with accuracy comparable to, and in some cases exceeding, human radiologists. More importantly, they can reduce false negatives, cases where cancer is present but missed. Early detection dramatically improves survival rates, and AI helps ensure fewer cases slip through the cracks. But imaging is only the beginning. One of the most powerful uses of AI in healthcare today is predictive analytics, using data to anticipate problems before they become emergencies. Hospitals generate enormous amounts of data every day: heart rates, blood pressure readings, oxygen levels, lab results, medication records, and more. Traditionally, much of this data is reviewed periodically, not continuously. AI changes that. Advanced monitoring systems now analyze patient data in real time to predict conditions like sepsis, a life-threatening response to infection. Sepsis can escalate rapidly and is notoriously difficult to diagnose early because its symptoms often resemble less serious illnesses. AI models trained on thousands of past sepsis cases can recognize subtle patterns that indicate risk hours before clinical symptoms become obvious. Early warnings allow doctors to intervene sooner with antibiotics and supportive care, significantly reducing mortality. This shift from reacting to illness to predicting it represents a fundamental transformation in medicine. Instead of waiting for a patient to crash, healthcare teams can act proactively. And that proactive approach is saving lives every single day. AI is also changing emergency medicine beyond hospital walls. In emergency dispatch centers, AI-assisted systems analyze incoming calls, voice patterns, and keywords to help identify cardiac arrest, stroke, or respiratory distress more quickly. Some systems can detect agonal breathing, a key sign of cardiac arrest, even when callers don't recognize it themselves. Faster recognition leads to faster dispatch of emergency services and better instructions for bystanders, improving survival rates before paramedics even arrive. Once emergency responders are on the scene, technology continues to help. Wearable devices and portable monitors equipped with AI can assess vital signs, detect irregular heart rhythms, and transmit real-time data to hospitals en route. This allows emergency departments to prepare in advance, shaving precious minutes off treatment times. Speaking of wearables, AI-driven health technology is increasingly moving into people's everyday lives. Smartwatches and fitness trackers are no longer just counting steps. Many can now detect atrial fibrillation, a common heart rhythm disorder that significantly increases the risk of stroke. These devices use machine learning algorithms to analyze heart rate patterns and alert users to potential problems, often before any symptoms appear. There are documented cases where people sought medical attention after receiving such alerts, leading to early diagnosis and treatment that likely prevented serious complications. While wearables are not diagnostic tools on their own, they act as an early warning system, encouraging timely medical evaluation. For many users, this has been life-changing. Remote patient monitoring is another area where AI is quietly transforming care. Patients with chronic conditions like heart failure, diabetes, or chronic obstructive pulmonary disease can now be monitored from home using connected devices. AI analyzes incoming data to identify concerning trends, such as rising blood glucose levels or worsening respiratory function. Clinicians are alerted when intervention is needed, reducing hospital readmissions and preventing emergencies. This is particularly important for aging populations and for patients living in rural or underserved areas. Instead of frequent hospital visits, care comes to them continuous, personalized, and data-driven. The result is better quality of life and, in many cases, longer survival. AI is also playing a critical role in drug discovery and treatment optimization. Developing new medications traditionally takes years and costs billions of dollars. AI accelerates this process by analyzing vast data sets of molecular structures, biological pathways, and clinical trial results to identify promising drug candidates more efficiently. This approach has already contributed to faster development of treatments for various conditions, including rare diseases that previously received little research attention. Beyond discovering new drugs, AI helps tailor existing treatments to individual patients. In oncology, for example, AI systems analyze genetic data from tumors to help doctors select therapies most likely to be effective for a specific patient. This personalized approach reduces trial and error prescribing and increases the chances of successful treatment, while minimizing harmful side effects. Mental health care, often under-resourced and stigmatized, is also benefiting from AI-driven innovation. AI-powered tools can analyze speech patterns, text messages, and behavioral data to identify signs of depression, anxiety, or suicidal ideation. Some systems are used to support clinicians by flagging high-risk patients, while others provide immediate, accessible support through digital platforms. While AI is not a replacement for human connection or professional care, it can serve as an early detection and support tool, especially for individuals who might not otherwise seek help. In crisis situations, timely intervention can be life-saving. Of course, it's important to address the challenges and ethical considerations that come with these technologies. AI systems are only as good as the data they are trained on. Biased or incomplete data can lead to unequal outcomes, potentially worsening existing health disparities. Privacy is another major concern. Health data is deeply personal, and safeguarding it is essential to maintaining trust, providing insights while leaving final decisions in human hands. What's remarkable is that even with these challenges, the evidence is clear. AI and health tech are already making healthcare safer, faster, and more effective. They are reducing diagnostic errors, improving early detection, expanding access to care, and enabling more personalized treatment. And most importantly, they are saving lives that might otherwise have been lost to delay, oversight, or limited resources. As we look ahead, the potential only grows. Integration of AI with genomics, robotics, and advanced sensors promises even more precise and proactive care. But the most important thing to remember is that the future of healthcare isn't about machines replacing people. It's about empowering humans with better tools to do what they've always done: care for one another. Every alert that catches a silent heart rhythm disorder, every scan that reveals a tumor before it spreads, every early warning that prevents a patient, and stay connected with us for more deep dives into the ideas and breakthroughs that are changing lives right now. Thanks for watching, and we'll see you in the next one.